Dr. Rani Bhat, as you all know, may be knowing already, she's MBBS, MS, Obstetric Gynecology, MRCOG from UK. She has numerous credentials. The following are Fellowship in Gynecological Oncology, Singapore, Fellowship in Robotic Surgery, Hong Kong, Diploma in Gynecological Operative Endoscopy, France, Senior Consultant and Head of Gynecological Oncology, Apollo Cancer Hospital, Bangalore, Director of Gynecological Oncology Fellowship Program, Apollo Cancer Hospital, Bangalore. She has received several national and international awards for her work in gynecological oncology. Has more than 30 publications in national and international journals. Her special interest, however, is high-tech and minimally invasive surgery in gynecological oncology. So, over to you, Dr. Rani Bhat.
Good evening, everyone. Thank you so much for giving us this opportunity to be here on this lovely Sunday. And I have a little twist in my topic name because, like you know, every time wherever we go, I talk only about gynae malignancies. So, obviously, when we have both the genders attending, I thought this is a topic which would bring interest in both the genders, and this is a topic which I think we are totally ignoring in the males. So human papillomavirus, we all know, and we've been talking about it in n number of meetings, that human papillomavirus is very, very important because it causes cervical cancer. So today I thought this is the virus which we can easily prevent, and we kind of are totally neglecting. So instead of me talking general about endometrial cancer, cervical cancer, which we already know, I thought I'll emphasize only on human papillomavirus today. Okay. So most of the time whenever this virus is linked to, we know it is a sexually transmitted virus. So when it is a sexually transmitted, we kind of are very, very shy to talk about it. So when we are shy, obviously how are we going to kind of educate our near and dear ones and our patients? So the stigma which is been associated with this human papilloma virus, because it is a sexually transmitted infection, it is not spoken about, and let me tell you, it is one of the most common virus which is there in both males and females who are sexually active. So if we keep this stigma away and we try to understand, then it would be easy for us to know about this human papilloma virus and how we can easily prevent it. Sorry. I think me being the opening batsman, there will be some hurdles in the presentation. So today what I really want to talk about is, human papillomavirus, which can cause cancer in males also. So if you really go and Google and put it as a HPV in men, we do have n number of studies which shows that human papillomavirus causes quite a few cancers even in males. So this is a
when
small
Mary,
video which
father of
tells...
three, Jason Mendelson, felt a strange lump on his neck a few years ago, he got it checked out right away.
When I got diagnosed with stage 4 HPV-related oral cancer, my life stopped.
Jason has since recovered from his cancer and is determined to raise awareness about the virus.
Let me tell you why I love your mother.
He's gotten his kids vaccinated and wants everyone to know it is preventable.
So what it says is that this person had stage 4 head and neck caused by human papillomavirus, and he is going around now educating people saying this virus can be prevented, and he's got his children vaccinated. So it is, yes, human papillomavirus causes cancer in males too. We know in females, cervical cancer is one of the common thing. What I want to today is that I hope we get enough knowledge to understand this human papillomavirus, the risk of it even in males, and how we can prevent it. So if you see human papillomavirus, especially Douglas, when he came out and he spoke out and he said, yes, he had his head and neck oral cancer and it was caused by human papillomavirus. And he said possibly it could be because of the oral sex. That is the reason why he acquired this human papillomavirus and later developed oral cancer. Now, are we following Western culture here in India? Is a question most of the time we see and we tell our children saying oh, these younger generation are following the Western culture. So, but I think we shouldn't be judgmental, because if you go back and look at the carvings onto the temple, you do see that oral sex was been carved in various temples, even in our own India, way back from 885 to 1050 AD. So let's not be judgmental. Yes, it can lead to oral cancer because of the oral sex. Now, this is a slide which tells the human papillomavirus causing cancers both in males and females. So if you see cervical cancer, virtually all of them we generally say is caused by human papillomavirus. Oral, both in males and females, 70% of them are caused by human papillomavirus. In males, penile cancer, 63% of them are caused by human papillomavirus. Vaginal, 75% of them are caused by human papilloma. Vulval, 70% are caused. Anal, both in males and females, 91% of them are related to human papillomavirus. So this slide clearly tells us that yes, it causes cancer both in males and females, and we have various organs which are affected by this human papillomavirus. So human papillomavirus is a simple virus. We know it is a simple virus, and there are about 200 strains of such viruses. And it is said that all of us will get infected with this virus sometime or the other in our lifetime. So there is no way escaping. Like how we can't escape COVID, we can't escape this human papillomavirus too. Now, most important, what I want to tell tonight is that though this virus causes cancer, the good news is this: we can prevent cancer with HPV vaccination. And people are telling, including the CDC is saying, yes, we have to vaccinate both girls and boys. Now, as I said, human papillomavirus can cause oral cancers, it can cause penile cancers in males, it can cause vaginal, vulval in women. Now, there are about two types of viruses we generally categorize: low risk. The low risk viruses causes what we say as genital warts. It could be warts in the mouth, it could be genital warts onto the penis or to the vagina or the vulva. So if you see any young people coming to your clinic and complaining of small cauliflower kind of a growth onto their external genitalia, then that could be because of a human papilloma virus. So these viruses, the low risk one, they just cause a simple growth, what we say as a genital wart. Now coming to the high risk, there are quite a few high risk viruses. Now this virus, if it stays in the body for a long period of time, that's when it can cause cancer both in males and females. Now, as I said, this virus is very, very common in sexually active, both males and females. And literally they say yes, we would be infected with human papilloma virus in our lifetime. So most of them, they panic saying it is a sexually transmitted. When my patients come with me with a pap smear report and HPV positive, the first thing their eyebrows go up saying, is my husband cheating on me or something? So it is not that I tell my patients human papilloma virus is there in the external genitalia of both males and females. It is there. Now, how do we get COVID? Is it through the droplet infection? How do we get influenza? Is it a droplet? So similarly, this virus is there on the external genitalia of both the males and the females. During sexual intercourse, what happens? The partners, they transmit their virus to the other partner. So it is there. It is never there a human who doesn't have this human papilloma virus. So because sexual transmission, one partner transmits their virus to the other partner, we call it as a sexually transmitted disease. So if this disease is there, it absolutely doesn't cause any symptoms. You don't have any flu-like symptoms, no white discharge in women, no itching or anything, because this doesn't cause any symptoms. If your body immunity is really good, your immune system will fight away this infection, and on an average we say 6 months to 2 years, the body kinds of rejects this virus and you will be absolutely virus free. So you don't have to worry. And yes, even when partners are in a single relationship, they can have human papilloma. Again, I'm emphasizing that human papillomavirus causes quite a few virus in males and in females. So males, especially because as I said, we have heard about human papillomavirus causing cervical cancer. I want to tell this that males also are at risk of developing penile, anus, oropharyngeal cancers. So, this is a very common virus, even males are there. So this is the statistics, the study which I've taken from Indian study, because most of the time what we do is we project the Western study and we talk about it and then we tell, oh, it will not happen to us. See, that is the first thing we say, it will not happen to us. So no wonder I picked up the Indian studies where luckily we have a very good study which tells the types of cancers and what is the incidence of the virus in them. So cervical cancer, we all know, for unfortunately the breast is taken over and no wonder cervix has become the second most common cancer in women. And the second most common cancer is, they say, between the age group of 15 to 44. If you see, 83% of them are caused by human papillomavirus. Again, as I say, this is a fantastic study what we have in the Indian population. 83% of the cervical cancer are caused by human papillomavirus. Similarly, if you take vulval cancer, unfortunately, vulval cancer doesn't have a very good study in India because vulval cancer is generally less when compared to the Western population. But we do say 6% of them can be caused by the, vulval human papilloma is caused by 28% by the human papilloma virus related to the vulval cancer. Next, coming to the vaginal cancer. Vaginal cancer is one of the rare cancers of the female reproductive organs. 71% of them are caused by human papillomavirus again. Anal cancer, both males and females are at risk of developing because of the human papillomavirus. So if you see, 80% of these anal cancers are caused by human papillomavirus, and this is combined both sexes, both for males and females. Head and neck oropharyngeal cancer. Now both men and women are at risk. Now for some reason, men are more at risk than women for head and neck. Again, if you see, 30% of these people are contributed because of a human papilloma. Now in head and neck, when we take oral cavity, if you see the red line, that is men compared to women. So head and neck cancers are more in males than in females. And again, both males and females, the human papilloma virus, if you see, 74 to 68%. So on an average, if you look, like 70% of head and neck, or it could be genital, they are caused by human papilloma virus. Laryngeal, again, the study says 34% of them are caused by human papilloma. Penile cancer, now coming to male cancers. Penile cancer is rare though, but it affects between 50 to 70 years, and they say it is very common in African, South American and in Asian population. Now penile cancer, it is said almost 63% of them can be caused by human papilloma virus. So I want to stress again, human papilloma virus is a sexually transmitted. It could be a vaginal penile sex, penile anal, penile oral, vaginal oral, or using some sterilized sex toys shared by common partners. We do, I'm sure it is going to be a huge challenge for us in the coming years because gays, it's become, gay partners or lesbians, it has become legal. And these are the groups who are at risk of having this human papilloma virus. So in our practice, I am sure in the coming years, we'll be seeing quite a few of such population. So I wanted to tell that saying both males and females will be at risk. And condom use, it will not completely prevent one person or the other person from getting a HPV. Because what happens, the condom is used only at the act of penetration. So even that skin to skin touch of the external genitalia, the risk of transmission is there. Yes, it can, but it's not 100% protection when somebody wears a condom. So again, I want to tell that yes, HPV causes cancers both in males and females, and especially if you look at anal and head and neck, both males and females are at risk of developing because of a human papilloma virus. Now, having spoken about so much about virus and causing so many cancers in the body, how do we prevent it? As I said, this is the only cancer which has a vaccine, and we do have this human papilloma virus vaccine. And it is, believe me, when I went to Australia way back in 2006 for my first fellowship, that is when the human papillomavirus had come, and Australia were kind of hell-bent upon that every girl, higher secondary school girl, has to get the vaccine. And now if you look, Australia is on the verge of eradicating human papillomavirus and verge of eradicating cervical cancer, because they started vaccinating their young girls from age of 11. So human papillomavirus recommendation is both girls and boys have to get this. So I have told you enough why it is important even the boys have to get it, because they are also at risk of developing viruses. So the recommended age is from 9 to 12 years we start off, and the best is like before the age of 25. I'll show you. Now the best time what we generally say is you can start from 9, and if your child is less than 15 years, you just need to give them 2 doses of vaccine. So best time from 9 to less than 15 years, you get only 2 doses. So if a girl or a boy takes today 1, then the second dose will be either 6 months or 12 months later, the second dose of vaccine is given. Now, if somebody gets vaccine after 15 years, then you need to give them 3 doses. So 3 doses, the schedule will be 0, 1 to 2, from the first dose, and the third dose is going to be 6 months from the first dose. So let me repeat myself. The best time to be given is from 9 to 15 years. If you do this, you just need to give them 2 doses. After 15, if you are giving, you have to give them 3 doses of vaccine. Now, can this vaccine be given to older age? Yes, now studies have shown that you can extend up to 45. But the best time is before they're sexually active is the best time, because I told you it's a sexually transmitted. So if you give this vaccine before being sexually active, that is the best time. Because if you take later on, what happens is you have already got the virus in your body. If you take a vaccine, it's not going to cure the virus which you have in your body, but it is going to prevent further infections. So it doesn't mean once you've got this infection, you're not likely to get it. It is there in the external genitalia, like how the mutants keeps changing. They can keep changing and you can get. So no wonder they say, yes, there is a benefit even for those people who get up to 45, because it will prevent new infections. So please let me repeat, if your patient comes to you with a pap smear report and says HPV DNA positive, a 30-year-old, please don't tell you're already positive, no use of taking vaccine. She will benefit from taking vaccine because it will prevent new virus. So no wonder they've extended the age of 45. Again, let me remind, after 15 years, you have to give them 3 doses. Less than 15, it is just 2 doses. Now, please, okay, so in this age group, if you are giving until 45, it is 3 doses. Less than 15, it is just going to be 2 doses. Now, how effective is this vaccine? Human papilloma, it is said like 90% HPV related cancers it can prevent. So it is such a beauty that we've been having this vaccine and we do not know much about it, and we are kind of scared to educate or scared to give to our patients, because unfortunately, there was a study which happened in India, and there were some deaths in Andhra Pradesh, and they attributed it to the vaccine. When we went digging into it, it was nothing related to the vaccine. It was related because of a suicide, and one was a snake bite. So people panicked, and then they kind of like went one step back. So the negative media kinds of catches up and we forget the positive. Yes, every medication will have some side effect. COVID-19 vaccine, when we came in, we didn't have number of years of research which was done, but we were eager to get that vaccine. But this is a vaccine which has been there since 2006. It has proven it is safe. It has proven that it can prevent cancer, but still not many people are aware of it. So as I said, it prevents literally. I'm really happy that Australia is on the verge of eradicating human papillomavirus. Yes, if we start now, we will take some years, but I'm sure we are going to reach there. So again, once you take this virus or you advise your patient to take this vaccination, please tell them it is not 100% protection. You still have to come for your pap smear. So for female patients, please tell them, despite of taking this vaccine, you still have to come. It is not 100%. You may be in that 5% who may can get a cervical cancer. So please tell patients you have to continue the cervical cancer screening. Now, Who should not get a vaccine? Now, obviously, if there is some allergy in the past for some vaccination, they should tell. And most of the time it is, if at all they have some life-threatening allergies and allergy to the yeast, especially Gardasil. We have two kinds of vaccine. The Gardasil is made up of the yeast, so no wonder we say if any allergy to yeast, then we shouldn't give vaccine. And obviously if somebody is pregnant, that is, we all know when somebody is pregnant, we don't give them any vaccine during pregnancy. Now, side effects, they're generally safe like any other side effects. Like recently, all of us have got a COVID vaccine and we know what kind of side effects we are going to have. It is just going to be pain at the injection site, little bit of induration, some tenderness. That is the simple side effects again we are going to have with the HPV vaccine. Now, coming to the most important, there are two kinds of vaccines available. One is Gardasil and other one is the Cervarix. Now, Gardasil, previously we had a simple Gardasil. Simple Gardasil was covering 4 viruses. So, of the 4, 2 were the low risk and 2 were the high risk. So, that means if you give the risk of somebody developing the papillary projections, the genital warts was less in them. So, later came the Cervarix. Cervarix was covering only the high risk which causes cancer. So, if you give Cervarix, you know, you are not protecting your patients from developing genital warts. So, before being sexually active, I generally recommend you give them Gardasil because it also prevents the genital warts in this population. If somebody has been sexually active already, so the HPV has been transmitted. If they have not developed a genital warts, they are unlikely to develop genital warts. So, in them I say, okay, fine, you can take Cervarix. But people who are not been sexually active and you want to give them, then Gardasil is the best. Now, Gardasil, as I said, previously we just had only one Gardasil which was covering 4 viruses. Now, we have Gardasil 9. So, Gardasil 9, again as it says, it covers 9 viruses. So, in US, it is only Gardasil 9 which is kind of like, you know, advised to be given. Obviously, you know, more viruses, there are cross kind of protection to the other strains. So, we have 9 viruses that will protect the other kinds of strains. So, Gardasil 9 is the best and that is what I recommend my patients in my practice. Now, Gardasil 9 was launched in India last year in September. It is not easily available in most of the pharmacies. Now, simple Gardasil cost is only about very close to 3,000 rupees. The Gardasil 9, because it's still not easily available, it is costing patients between 9,000 to 10,000 per dose. So, that is the next question. Most of them ask what is the cost. So, I generally tell, see, when you have to go to a restaurant to eat or you want to buy a car, you are looking the safety features in them. In the car, how many airbags do we have? So, this is your safety for your life. So, I tell my patients, why are you looking at? This is 3 doses you have to give. You have Ugadi festival coming. I am sure women are kind of eager to go do some shopping. So, you want, you know, the best silk saree. This is one time in your life what you are going to spend. So, don't look at the cost. You look at the huge benefit this vaccine is going to give our patients. Now, points to note. HPV vaccine, yes, it provides strong protection against all new infections. Vaccination is prevention and it does not cure the virus which we already have. And HPV vaccine is not used to treat. If somebody comes with a pap smear report and says, oh, you have HPV positive, please, we shouldn't tell them, you take this vaccine, it will be cured. No. HPV vaccine will prevent further infection. It is not going to cure the infection which the lady or the man already has it. So, prevention of HPV virus, awareness, as I said, such forums are the places where we sit and talk and we educate ourselves. This is the awareness. The second one is we have to advise safe sex. As I said, sexual intercourse between same-sex group is coming up. We need to educate them to be safe sex, not to have multiple sexual partners, because what happens when they change a partner, then they get a new virus. Your body has taken care of one virus already. You change a partner and now you're going to get another virus. So, educate them to have a safe sex. And then most important is if somebody comes to know they already have HPV virus, it's nothing to be ashamed. As I said, each one of us are likely to get this virus sometime or the other in our lifetime. So, more important, yes, we need to communicate properly, and we also say increase your immunity. The most important, if somebody is smoking, we tell them please decrease smoking, because people who smoke, the immunity is less. So you decrease that, and remember, tell our patients you're just not alone. It's a very common infection, and seek support from friends and family, and more important, from the doctors. So thank you so much for your patience listening, and that is my phone number, and I'm a little active, I'll say, on social media, not for anything, because these days younger generation, they learn more through social media. So this is a small effort to kind of like educate my younger generation through social media, both through Facebook and Instagram. I'll be sharing the barcodes for this. If you can share it with your patients, I do kind of like put in some health tips here and there and make it quite interesting. So if you all are onto social media, I'll be very happy if you can join me. And thank you so much. I think I'll be happy to take some questions now. Oh yes, thank you. Thank you so much, sir.
Thank you, Dr. Rani Bhat, for that excellent presentation. It was very informative, and also, most of us, we didn't have any knowledge about the vaccination. That was very important and very useful to all of us.